It's now just over a month since the Premier of Ontario announced a state of emergency for the province. Since that time, the number of cases and deaths from COVID-19 have mounted. However, today, there was encouraging news about the flattening of the curve, a slowdown in the number of cases, and an indication that the efforts to contain the virus are having an impact. This is the result of the stringent measures required by the federal and provincial governments since mid-March. The sacrifices we have all been asked to make to protect each other have been working. However, both the Prime Minister and the Premier expressed caution today about easing those measures too soon. Even in the face of this promising news, the frontline workers, the doctors, nurses, PSWs, first responders, store clerks, by law enforcement officers, essential workers remain overwhelmed. Long-term care homes and retirement residences remain in precarious jeopardy. The situation continues to evolve and restrictions will be gradually eased. However, we need to continue to be vigilant. As I've said before, this situation is not about any one of us, it is about all of us. The actions of each of us have an impact on how all of us will survive the pandemic and how quickly we can return to a semblance of normal life. I want to comment on several issues that appear to be most on the minds of our community. But I would also ask that you, for specific and detailed information, go to the Town of Fort Erie website, forterie.ca, which has a wealth of information and updates relative to this current crisis. With respect to seasonal residents, I've confirmed with the Regional Director General of the Canada Border Service Agency that her forces continue to follow the protocol adopted since the federal government announced last month restrictions on travel across the Canada-US border. Only essential travel is permitted, such as truck drivers with essential goods, essential workers, and returning nationals or landed immigrants. Returning Canadians are required to self-isolate for 14 days. Those who are working on either side of the border are to go to work and return home directly. Some of these individuals are permitted to drive American-plated vehicles. However, if you see someone who appears to be violating the protocol and you have information to permit enforcement of the protocol, you should contact the town and/or Canada Border Services Agency to lodge a complaint. Short-term rentals are not permitted to operate by provincial directive unless for bookings after April the 4th for accommodations related to essential need. That means that vacationers should not be coming into town for short stays. Seasonal residents who live elsewhere in Ontario have been encouraged by the federal and provincial governments to remain in their home communities. That is, stay home. Sherkston Shores has been closed to all but those Canadian residents who maintain their permanent home in Canada there. The Town of Fort Erie can be contacted at 905-871-1600 or by email by going to the website, forterie.ca. The Niagara region can be contacted at 905-984-3690 or by going to its website, niagararegion.ca. And Canada Border Services can be contacted at 905-354-5137. Beaches, boat launches, trails, parks, and playgrounds. For the time being, the beaches, boat launches, and playgrounds in town are closed. Parks and recreational trails are open, but individuals must maintain social distancing. We are aware that people would like to walk the beaches, but I remind everyone that the town-owned beaches are primarily 66-foot road allowances. The exceptions being Bay Beach, which is 1,000 feet of beach front, and Waverly Beach, about 200 feet. We're also aware that boaters would like to get out on the lake or river. We continue to monitor the situation and will make decisions changing the status in the context of safety and adherence to social distancing rules. In the meantime, the public is permitted to walk, run, cycle, and get fresh air, but not congregate in our passive parks and on the recreational trails in town. With respect to public health, we have received many expressions of concern about the amount of information being shared by Niagara Regional Public Health Agency. While the information displayed on its website has improved over the past week, there remains important data that could and should be shared. The number of tests conducted in Niagara, results and pending results, specifics as to the cases in long-term care homes and retirement residences, a breakdown of cases by municipality. I have corresponded with the acting Chief Medical Officer of Health for Niagara Region, voicing my concerns in this regard. I know that Regional Councillor Encina has expressed similar concerns. They will be raised at the Regional Council meeting scheduled for Thursday this week. The landfill site. The local landfill site on Pettit Road is operated by the region. It is open for essential disposals with a variety of qualifications, really too many to get into right now. I urge you to go to the region's website to ascertain its availability for use. There has also been a recent update today by the Town of Fort Erie with respect to the landfill, but for more detailed information, go to the region website. In the meantime, Regional Councillor Encina and I will be raising concerns about the restrictions imposed at the landfill site during a time when people are doing work around their homes because of federal and provincial directives and need to be able to dispose of refuse. Town operations. The town continues most of its operations, including processing, planning, and building applications, engineering and design work on projects, maintenance of facilities, equipment, and infrastructure, outreach to businesses, and customer service. Over 80% of employees are working from home. Almost all of the volunteer firefighters are active and available for service. Outside work crews are working in shifts and maintaining social distance. The mayors and regional chair and various senior staff meet regularly electronically with their counterparts. Members of council continue to respond to constituents' needs and interact with senior staff. Council will be receiving a report at the beginning of May, apprising us and the public of the financial implications on the municipality of the COVID-19 emergency. Vandalism. There have been a number of incidents of vandalism in a variety of areas of town over the past couple of weeks. I cannot imagine what possesses someone to deface the property of others, including the community. I cannot imagine a more senseless act. It benefits no one. In response, the town will be erecting security cameras in select locations to ensure that should this type of conduct persist, the perpetrators will be found out and appropriately dealt with by the law. And then finally, I wanted to make some comments about volunteers. There have been many volunteers and frequent good works that have taken place in Fort Erie over the past month. Many of the nonprofit organizations in town have also suffered a loss of critical revenues with the closure of the bingo halls. Many individuals and some businesses and developers have offered assistance to them in this stressful time. I want to thank everyone who has been generous in a time when we are all feeling overwhelmed. And I encourage those of you who can to make a donation to a service club, charity, food bank, or nonprofit organization of your choice. Some service clubs, and I hesitate to mention any specifically, but I'm aware of the Ridgeway Lions who are offering meals to those in need, pickup and curbside delivery, and they're delivering about 350 meals 3 times a week. And the Canettes, who have offered to offset the cost of some of our healthcare providers who require accommodations away from home because of the hours that they're working and their concern about spreading the virus to their families. And they have done what the service clubs have done, what they always do, as have the other service clubs. They've stepped up to serve our community. The food banks are struggling to maintain inventory for all those in need. Those and other community organizations have been receiving donations and offers of assistance from across our town. To all the members of the service clubs and organizations, to each generous individual and business, to everyone who is trying to brighten the day for those around you, to our healthcare providers, first responders, and essential workers, I say thank you, thank you, thank you. The council, your family, friends, and neighbors are truly appreciative. We will overcome this crisis, and because of all of you, we will do it sooner and with a sense of optimism.